This lecture is on the thyroid and parathyroid glands. So the thyroid gland then is located in the neck just below the larynx and in front of the trachea. So essentially, if you can find your Adam's apple, remember that's how you can find the anterior portion of your larynx. So just below here, there's a little bit of soft tissue. That then is your thyroid gland. So the thyroid gland secretes the hormone thyroxine. You have already heard of thyroxine. Thyroxine, which is iodine containing, and this deserves a little bit of discussion. Okay, so your primary need for iodine as a part of your nutrients is for your thyroid gland so that it can make thyroxine. Iodine occurs naturally in foods that come from the sea. There is iodine in seawater. There are a couple of things that are important about this. First of all, it does mean that before the days of being able to get foods from other places, people who lived in the interiors of continents sometimes wound up having iodine deficiencies. We'll talk more about that in a moment. But another problem is that because our thyroid gland really needs that iodine, this also means that if you take in iodine, it's going to go directly to your thyroid gland. And this means that when there is radioactive iodine in the environment, as sometimes happens when there are meltdowns or partial meltdowns or problems at nuclear power plants, you can wind up with radioactive iodine being released. And if that happens, if people are exposed to this, that iodine will unfortunately head straight for their thyroid gland. And you then have this little source of radiation, very concentrated, and people can get thyroid cancer this way. There was a sharp uptick in thyroid cancers, for instance, after the Chernobyl meltdown, the Chernobyl power plant meltdown. Another thing that can happen is that sometimes radioactive iodine is used in hospital settings for very legitimate purposes, but it also means it needs to be handled with extreme care. So, as I said, just by way of understanding the importance of iodine with thyroxine. So what does thyroxine do then? It regulates the rate of metabolism in the body. It increases the rate of protein carbohydrate and fat metabolism and the rate of cellular respiration. So all of these have to do with your body's using energy. The increase of the rate of protein, carbohydrate, and fat metabolism, and then also the rate of cellular respiration, the rate of using oxygen. So as I said, in the absence of thyroxine, you're going to have serious problems with being able to use energy. So this hormone is necessary for normal mental and physical development. So if a child growing up is lacking in thyroxine for any number of reasons, including lacking dietary iodine, then you can wind up having development, both physically and mentally, be handicapped. And levels of thyroxine are regulated, as you know, through the negative feedback cycle involving good old thyroid stimulating hormone, which we discussed when we were talking about the pituitary gland. Here we have TSH, which is secreted by the anterior pituitary. So there we are. When things go well, you wind up having your energy use, your metabolism, fairly nicely and tightly regulated by this negative feedback cycle. So now we're going to talk about another hormone, still a thyroid hormone. So the thyroid also secretes the hormone calcitonin, which is involved in the regulation of blood calcium levels. In interaction with the parathyroid hormone, which is conveniently called parathormone, and more on that in a little while. But before then, there is a condition known as goiter. And this is the enlargement of the thyroid gland caused by a deficiency in iodine. And this is rarely seen in the U.S. due to the widespread use of iodized salts. So this was a case of creative problem solving. What happened was that in a big continent like the United States, we have a lot of the interior, and as I said, back in the days before we received food from all over, people in the interior of any large continent did run the risk of having an iodine deficiency, which could lead to various handicaps having to do with the lack of thyroxine, but you would also just see an enlargement here of the thyroid gland itself, and that enlargement is known as a goiter. And what we found is that if you attach iodine to salt, to table salt, so that you get iodized salt, salt doesn't go bad. So if iodized salt was used across the country, then anybody who used salt, and it's a very common thing to put on food, that anybody who used salt would wind up, therefore, not having a dietary deficiency of iodine. So iodized salt solved that problem for us, and it was a rather clever thing to do. If you take a look at salt in the supermarket, almost any box of salt that you buy will say iodized salt on it. People who are put on very, very low sodium diets may not use table salt, and they may wind up having to be concerned about iodine levels in their diet. But by and large, as I said, people in the United States usually don't have to worry about getting enough dietary iodine because we get it in our salt. Now I'm going to move on to the parathyroid gland. Okay, so the parathyroid gland then is composed, and I want to make sure you understand that this is one word here. Let's do this a little better. There. So the parathyroid gland is composed of 4 tiny oval glands which are embedded in the back of the thyroid. So when you've found your thyroid, then if you just imagine the back, the posterior side of it, then there will just be these 4 tiny little ovals actually embedded in that tissue at the back, but it's a different gland, and that's the parathyroid gland. So the parathyroid then secretes parathormone, a handy name for a hormone. So it secretes parathormone, which regulates calcium and phosphate metabolism. In a negative feedback cycle with calcitonin, which we just discussed. So parathormone specifically causes the release of calcium from bone and into your blood plasma. And deficiency of parathormone results in low blood calcium levels. And this, the low blood calcium levels, then can result in a condition known as tetany, which is a state in which muscles become hypersensitive and they may contract violently. So what's going on here is that you have calcitonin and you have parathormone. And together then they will control the levels of calcium in your blood. And they do this then by either putting calcium from the blood plasma into your bone, or in the case of parathormone, taking calcium out of the bone and putting it into your blood. So as I said, again, we have this tight negative feedback cycle, which means that your blood plasma should always have the right level of calcium in it. And then that right level of calcium is maintained by either raiding the bones for calcium or by putting calcium into the bones. So the bones are basically your calcium bank. And this is why you need to replenish the calcium in your bones, because it turns out that, once the calcium gets used by muscle contraction, you don't necessarily get it back. So as a result, this is why we need to keep feeding calcium into our bones. A, because we want strong bones, but B, so that we can maintain healthy blood calcium levels, because the healthy blood calcium levels will be maintained even at the expense of making your bones very brittle and porous. I hope this is making sense. And this is the end of this lecture.